Today we are faced with one of the most critical issues we have to deal with. It's one of those questions that can actually change someone's life forever. Pancreatic cancer. We can call it a silent killer because it is diagnosed quite late. The pancreas is an organ located in the abdomen, behind the lower part of the stomach. Pancreatic cancer starts in the pancreatic tissue and is difficult to diagnose, which is the main factor that complicates the treatment process. Symptoms may not appear immediately, or may be confused with common daily symptoms that people experience. It is therefore very important to know what symptoms to look out for. In today's video, we will talk about 9 warning signs of pancreatic cancer that should not be ignored. Your body can let you know with these warning signs. This makes a big difference in people getting the right treatment earlier. Some of these may be things you've heard before, but didn't think could be related to pancreatic cancer. The pancreas is an organ about the size of a human hand that is located behind the lower part of the stomach. Its main job is to control blood sugar and produce hormones and enzymes that help us digest food. Pancreatic cancer starts when abnormal cells in the pancreas grow out of control and form a tumor. Pancreatic cancer has no symptoms until the tumor grows or spreads elsewhere, which shows how treacherous an organ it is. The most obvious warning signs of pancreatic cancer, such as stomach pain, weight loss without effort, and fatigue, can be interpreted as common symptoms. For this reason, people do not seek medical attention immediately, which is a great opportunity for the cancer to grow silently. Being informed helps us make better decisions for our health. Let's take a look at these warning signs together. Before we move on to the symptoms, please don't forget to subscribe to our channel, like and comment on the video. 1. Jaundice. Jaundice is a condition in which the skin and whites of the eyes turn yellow due to increased levels of bilirubin in the blood. Bilirubin is a yellow pigment that the body produces when it breaks down old red blood cells. Normally, the liver processes bilirubin by mixing it with bile and getting rid of it through the digestive system. But in some abnormal conditions, the liver may not secrete bilirubin and may not be able to remove it from the body. In this case, you will have high levels of bilirubin in your body, causing you to become jaundiced. This is a sign of a health problem, not a disease in itself. There are several reasons why a person can become jaundiced. Liver disease, such as hepatitis or cirrhosis, or blockages in the bile ducts, the way bile travels from the liver to the intestines, are the most obvious causes. Jaundice in adults usually indicates a serious health problem that requires medical attention. In addition to yellowing of the skin and eyes, it may be associated with symptoms such as dark urine, pale stools, and itching. These symptoms should be considered and treatment initiated. 2. Unexplained weight loss. Unexplained weight loss is something that happens to a person without any intention of dieting or exercising. If your clothes feel looser or the number you see on the scale goes down without changing your eating habits, you are losing weight without realizing it. While this may seem like a pleasant surprise at first, it could be a sign of an underlying health problem. If this weight loss is unintentional, it could be a symptom of an overactive thyroid, diabetes, or a digestive disorder. Most importantly, it can be a sign of many cancers, including pancreatic cancer. Unexplained weight loss can occur in pancreatic cancer for a variety of reasons. The exocrine function of the pancreas, which produces enzymes that help digest food, can be compromised, leading to malabsorption and weight loss. In addition, a tumor pressing on the stomach can cause a person to feel full after eating a small amount of food. Unexplained weight loss should be taken seriously, especially if it is more than 5% of body weight. 3. Abdominal pain. Abdominal pain is one of the most common symptoms. It occurs in the area between the chest and the pelvis. Since this area of the body contains many important internal organs, such as the stomach, liver, pancreas, and intestines, abdominal pain can have many causes. The type of abdominal pain to look for in pancreatic cancer is usually located in the mid-upper abdomen. It is usually not relieved by over-the-counter pain relievers and can be severe and debilitating. The pain is usually related to the tumor growing inside the pancreas or spreading outside the pancreas. If the tumor has spread to other parts of the body, it can also cause pain by pressing on nearby organs or tissues. In this case, it is considered an advanced symptom, and a doctor should be consulted immediately. 4. Loss of appetite and feeling full after eating a small amount of food. Loss of appetite is when a person's desire to eat decreases, while feeling full after eating a small amount of food is the feeling of having eaten enough despite not having consumed much food. Both symptoms are often associated with various health problems, ranging from mild to severe. They can occur for many reasons, including mental health problems such as stress or depression, stomach problems such as gastritis or ulcers, infections, or cancer. As mentioned earlier, a tumor in the pancreas can put pressure on nearby organs, including the stomach, causing a person to feel full even after eating small amounts of food. If the tumor grows large enough to interfere with the function of nearby organs, it may indicate an advanced stage of pancreatic cancer. A healthcare professional should be consulted immediately. 5. Nausea and vomiting. Nausea is an uncomfortable feeling in the stomach that may precede vomiting, while vomiting is the expulsion of stomach contents through the mouth. These symptoms may occur separately or together. In pancreatic cancer, nausea and vomiting can occur for several reasons. One possible cause is blockage of the bile ducts by the tumor. This can disrupt the normal flow of bile and digestive enzymes, causing nausea and vomiting. Another cause is that the tumor itself can irritate the stomach and nearby organs, causing nausea. Nausea and vomiting are usually more common in advanced stages of pancreatic cancer, when the tumor has grown large enough to interfere with the normal functioning of the digestive system. This symptom should not be ignored if it occurs in combination with other symptoms. 6. Changes in stool color. Normally, stools are brown in color due to the presence of bile, which is produced by the liver and helps digest and absorb fats. However, if there is a problem with the liver or pancreas, the color of the stool may change. In pancreatic cancer, the bile ducts may be blocked by the tumor, which can disrupt the normal flow of the intestines. This can cause pale or clay-colored stools. In addition, pancreatic cancer can affect the production of digestive enzymes, which can affect the digestion and absorption of fats, leading to changes in stool color, consistency, and odor. Any significant change in stool color should be evaluated by a healthcare professional, especially if it is persistent or accompanied by other symptoms. 7. New onset diabetes, or worsening of existing diabetes. Diabetes is a condition characterized by high blood sugar levels due to the body's inability to produce or use insulin effectively. There are different types, such as type 1, type 2, and gestational diabetes. Each type has its own causes and risk factors. The pancreas plays a role in regulating blood sugar levels by producing insulin, which helps cells in the body absorb glucose from the bloodstream. Pancreatic cancer can cause new-onset diabetes or worsen existing diabetes for several reasons. First, it can disrupt the normal function of the pancreas by affecting the production of insulin or other hormones involved in glucose metabolism. In addition, pancreatic cancer can cause inflammation and damage to the pancreas, further impairing its ability to produce insulin. As a result, blood glucose levels may rise, causing symptoms such as increased thirst, frequent urination, and fatigue. In this case, a healthcare professional should be consulted. 8. Back pain. Back pain is a very common condition that can occur for a variety of reasons. For example, muscle strains, ligament sprains, herniated discs, or arthritis. In some cases, back pain may be a sign of pancreatic cancer. One possible cause is the location of the pancreas in the body. The pancreas is located deep in the abdomen, close to the spine. As a result, a tumor in the pancreas can cause back pain by pressing on nearby nerves and organs. The pain can be severe, come and go, or be constant. If the pain is accompanied by vomiting and jaundice, you should see a doctor. 9. Tiredness. Fatigue is a common condition that can occur for a variety of reasons, such as lack of sleep, stress, anemia, or thyroid disorders, back pain. But because cancer causes changes in the body's metabolism and immune system, fatigue is one of the most common symptoms. In addition, pancreatic cancer symptoms such as abdominal pain, nausea, and vomiting can cause fatigue that interferes with sleep and daily activities. Fatigue is usually more common in advanced stages of pancreatic cancer, when the tumor has grown large enough to interfere with the body's normal functions. If persistent or severe fatigue occurs, a healthcare professional should be consulted. In conclusion, pancreatic cancer is a serious condition that requires immediate medical attention. These 9 symptoms may occur for a variety of reasons. They do not necessarily indicate pancreatic cancer, but they should not be ignored, especially if they are persistent or occur in combination with other worrisome causes. If you experience one or more of these symptoms, see a healthcare professional. Early detection and treatment of pancreatic cancer can significantly improve outcomes and quality of life. Remember, the earlier pancreatic cancer is detected, the more likely it is to be successfully treated. Thank you for watching us. Please don't forget to subscribe, like, and comment.